So let's get to the meat of the talk, which is the ASCO 2023 EGFR highlight reel. And these were just, abstracts and presentations that caught my eye, but there may be other things that are more interesting to you or more interesting to others. So this was just my thoughts. So here are the topics I'm going to talk about. Two studies in the neoadjuvant adjuvant space and 3 studies in the metastatic setting. So neoadjuvant adjuvant space is early stage lung cancer. The ADAURA I'm going to talk about in the adjuvant setting, and the NEO study in the neoadjuvant setting. And then the metastatic setting, Keynote 789, Everest, and then Blue 945 Symphony. So let's talk about ADAURA. I'm sure you've heard a lot about this study. So this is a study in the adjuvant setting, meaning these patients had resected early stage lung cancer, and then they received, chemotherapy, and they were randomized to receive osimertinib or placebo for about 3 years ongoing. So we had been hanging our hat and using osimertinib in this setting based on the disease-free survival benefit that had been presented at ASCO previously. And we were all anxiously awaiting the overall survival, right? Because you want to know, if you are going to go on this drug, you want to be sure that it's going to make you live longer, right? So we finally have this data, and I'm really excited to review it with you, although I'm sure you've probably heard a lot about it already. Anyways, this was beautifully presented at ASCO 2023 by Dr. Herbst. So here's a brief schema of the study design, but basically, as I had said, it's patients that have had completely resected stage B, 1B to stage 3A non-small cell lung cancer that harbored an EGFR alteration exon 19 or L858R. And these patients were completely resected, and they received chemotherapy. And some of them did not receive chemotherapy afterwards. But as you can see here, it says 10 weeks without adjuvant chemotherapy or 26 weeks with adjuvant chemotherapy. So there was definitely a stratification there. But after that time period, they were either randomized to receive osimertinib or placebo, ongoing for 3 years plus. And here are the baseline study characteristics. And something that I really want to make sure that I pay attention to is that the arms are equal, so that those that got osimertinib were equal to the same amount of patients that got placebo, that the age was fairly comparable in both arms, that the performance status, the histology, the mutations, the staging, everything looks pretty comparable in both arms. And here we have a Kaplan-Meier curve looking at the probability of overall survival. So osimertinib is in the red arm, as you can see on the top, and the placebo is in the blue. And you can see that there is a nice separation of the curves. So even just from looking at this, you can kind of get a glimmer that there probably is a survival advantage to take osimertinib after you've had resected disease if you have an EGFR alteration. However, it's always nice to see this statistical analysis and the data. So that's why I put the little blue star there, and you can see that there's an 88% 5-year overall survival advantage for those that received osimertinib, and a 78% 5-year overall survival advantage to those that received placebo. And the p-value is significant, and the hazard ratio is 0.49, which is a very nice hazard ratio that we like to see here. So there is a clear overall survival benefit to receive osimertinib after you had a resection if you are stage 1B to stage 3A. So what's the meat of this study? Basically, as I had said, there's an overall survival advantage to receive osimertinib. I told you the 5-year overall survival rate was 88% with OC versus 78% with placebo. However, I still have some questions. Do we adore ADAURA? So I found this term from JAMA. I know it's coined. I stole it from Dr. West, so thank you for that. I did give him slide credit down here. So my real question is, what's driving this overall survival benefit? Is it that we're just delaying the inevitable that this cancer could come back, or are we truly curing? And I don't think we know the answer to that. Obviously, I'm happy about this data, but that question is just always in the back of my mind. And there's always the risk of toxicity, right? So there's this beautiful slide that Jill Feldman, who's one of our amazing EGFR advocates and patients, puts up, where she looks absolutely wonderful on this slide, and you would look at her walking in the park and not think anything, but she has, muscle wasting, she's fatigued, she has mucositis, she has a rash, she has, weight loss, she has just all these other things you would never know about. So it's toxicity is huge, and taking this drug for 3 years or maybe even longer with with a survival advantage, but still, like, is it worth it to you? And that's why I really think you need to talk with your oncologist before you sign up for this.